Hello, I'm Dr. Dan Green. I'm one of the physicians at Contemporary Obstetrics and Gynecology, and I'm here to talk to you today about a new and better way of evaluating abnormal uterine bleeding that we have available for our patients here in the office. So, abnormal uterine bleeding, that is when women are having heavy periods, irregular periods, and even includes a category of women who are past the menopause that we call postmenopausal bleeding. These bleeding irregularities are very common. Heavy periods, irregular periods will occur in roughly somewhere between 10 to 30% of women in the age group between age 35 and menopause. Now, interestingly, more than half of those individuals have a cause in the uterine cavity itself. So the cavity, which is grown and shed each month, that empty space inside the uterus is the uterine cavity. And about 55% of the time in that age group, when women present to our office for evaluation of abnormal uterine bleeding, we find something in that cavity, such as a polyp or a fibroid. Now, these are typically both benign growths, but you're kind of stuck with them until we find out that they're there and do something about them, and they'll continue to cause abnormal bleeding as a consequence. So the key is finding a way to examine that cavity to, number one, make sure that the cavity is normal or abnormal. Now, as you see here in this slide, an example of a fibroid is to the right of the screen. That cavity you're looking into is the endometrial cavity or the uterine cavity, and the fibroid down around 7 o'clock you can see there. But you can see there's little blood vessels running over that, and those are very vascular, and they can result in varying degrees of bleeding. Similarly, polyps, which you see to your left, those abut out in the uterus, and they look very similar, but they're composed of different material, and they're very vascular. They can bleed sporadically, heavily, and contribute to these heavy bleeding problems. So we need to look at that lining of the uterus to make sure that we know whether they're there or not, so we can address the problem. In the postmenopausal group, there's another layer of significance because after menopause, polyps and fibroids also can cause abnormal bleeding, but this group of individuals has a higher risk factor for what's called endometrial hyperplasia, which are effectively precancers of the uterine lining, and those can progress to uterine cancers. So the number one reason, or the number one indication that we use to diagnose uterine cancers is, in fact, postmenopausal bleeding. The majority of women who have uterine cancers will present with bleeding that they shouldn't be having. So it's very important to have that cavity evaluated properly to find out what the cause of the bleeding is and to make sure the patient's safe and address the problem so it doesn't become an evolving or greater threat. Now, how do we evaluate the uterine cavity? Historically, we've done it by seeing the patient in the office, and we get a good history and we do a physical examination. Sometimes we have to order some blood tests, sometimes not. But then it really comes down to visualizing that cavity, or at least sampling the lining of that uterus. So the main ways that we do that are with hysteroscopy and ultrasound. Ultrasound is an indirect way of looking at the uterine lining. You can see in the picture in the middle here, toward the bottom, that black and white image, that uterus has been filled with saline, and you can see that there's something in there, which we suspect is a polyp or a fibroid or some kind of a growth. But with hysteroscopy, we're looking directly into the uterine cavity and we're visualizing it with our eyes effectively. And so we can more precisely diagnose what we're seeing and what that image would represent. Now, another thing that we can do to evaluate the uterine cavity is called a blind biopsy. It's called an endometrial biopsy. This is done in the office very similarly to the fashion that a pap smear would be obtained. The patient is put up in the examination position, and we slide a small catheter through the opening of the cervix. It goes up inside the uterine cavity, and with a very well-tolerated small amount of suction, as that device is removed, it samples the lining. It's a very good technique, and it keeps people out of the operating room, but the problem with it is that it can miss pathology in up to 18% of patients. So if there is a fibroid or a polyp, it may not catch it. And if there's a hyperplasia or even a cancer in some cases, it's going to miss it because those tend to be focal lesions, not throughout the whole cavity. So we've come up with the paradigm of doing hysteroscopy. Now, hysteroscopy can be done in the office or in the operating room. Office hysteroscopy has a few drawbacks. One is that it takes a long time. You have to get the surgery set up, you have to get into that OR, and you have to spend that day investing yourself in that procedure. For example, nothing to eat or drink after midnight, you go to the pre-op holding area, and you go through this operative process, which is very good, very thorough, and very comprehensive, but very involved and a little more expensive as well, and you have to miss work. The procedure we do in the office, this new device, Endosee office hysteroscopy, affords us as practitioners to provide a better experience for our patients. It takes less time. For example, a patient who has an Endosee procedure versus an operating room procedure just shows up to the office shortly before her appointment time. We do the examination in any one of our examination rooms. We don't need to have an OR per se. And the advantage is that it's very quick. It's very well tolerated and much less uncomfortable. The primary reason we send people to the operating room to do the procedure is because hysteroscopy done in the operating room requires a different instrument. It's a larger instrument, which is rigid and composed of metal. I have an example of one right here. This is a hysteroscope, and you can see it's about 5 to 7 millimeters in diameter, and it's rigid. So we insert this through the cervix into the uterine cavity, and we can visualize it through this operative eyepiece. The disadvantage, and the reason this is more uncomfortable, is because it requires anesthetic. It requires the cervix typically to be dilated or kind of forced open a little bit, which can be very uncomfortable. And then the insertion of the camera itself, due to its rigid nature, in some patients can provide varying degrees of discomfort as well. So most patients require some level of anesthetic to have this procedure performed. Whereas with the new Endosee device, which you see here, obviously much smaller. It reminds me of the well in an ink pen. It's about that size, but it's flexible, and it can insert much more easily, requiring less or no dilation of the cervix, and it can be accomplished quickly in the office. At the very end of this device, there's a small camera, which you may or may not be able to appreciate on this video, but this puts a camera directly into the uterus. We have a handpiece, which you see on your screen here, that attaches to the device that provides us an immediate picture of what's going on inside that uterus. Now, the advantage to that is, as I said, it's less uncomfortable, it's brief, and it's comprehensive. We have the ability to identify areas that may need biopsy if necessary, so we can get a definitive diagnosis. The patient's awake during the procedure, and it affords us the opportunity, once we're done, to sit and talk with a patient right then and there, know what we're dealing with, and come up with a plan moving forward to how we're going to address the cause of her abnormal uterine bleeding. That's advantageous in that it saves time for our patients, and our experience that we hear feedback from our patients all the time is that it creates a lot less anxiety. They don't have to think about going to the operating room. They don't have to wait for the results to come back, wait for their office appointment, and then formulate the plan. It's kind of one-stop shopping for your abnormal uterine bleeding evaluation in that sense. And so our satisfaction rates with that seem to be much greater. And I think we're serving our patients better as a consequence of that. So our experience has been very favorable with this device. It's extremely well tolerated, it's cost effective, and it provides us the opportunity to provide the best care for our patients. We get feedback from our patients. This has been a very good experience for them as well. So if you're having any problems with abnormal uterine bleeding, if you have further questions or concerns, please feel free to contact our office. You can visit our website. We appreciate your time today. Have a good day.